Administering your medication isn't a difficult process once you have had appropriate instruction. Please follow these step-by-step instructions. If you have any questions, we are available to assist. Before you start, please read your instructions carefully and make sure that you know the correct dose that you need to inject. Open the white tub. Take out a small syringe. The syringe is marked in units. You will be told exactly how many units to use as the dose varies. You can get multiple doses from the one vial of Lucrin. Remove the syringe from the packaging. Remove the plastic needle cover. Insert the needle into the middle of the rubber top of the vial. Turn the vial and syringe upside down. Pull the plunger back until the required number of units is measured on the syringe, with no air bubbles and only liquid in the syringe. Turn the vial and syringe upright again. Remove the needle from the vial. The best position for administering an injection is to sit in a chair. Lean back against the chair comfortably. It is not necessary to clean the area with an alcohol swab. But if you wish to do this, make sure to dry the area with a tissue or cotton wool before administering the injection. The injection can be administered anywhere in the abdomen, in this area below the belly button. Support the flesh between your thumb and finger. Do not squeeze too hard. Push the needle into the abdomen at a 45 to 90 degree angle. The 90-degree angle reduces post-injection bruising. Inject the medication. Ensure that the plunger of the syringe goes all the way in and all the medication is administered. Do not pull the needle out immediately. You can count to 5 to ensure all the medication has been injected and then pull the needle out. Gently press on the injection area. Cover the needle with the cap and discard appropriately into the sharp container. Replace the vial of Lucrin back into the white tub for your next use.